For thousands of years, physicians didn't have CT scanners, they didn't have hormone panels, they didn't have inflammatory markers. What they had was how all good science starts. They had observation. They watched patterns, they watched symptoms, they studied how stress reshaped the body, how digestion affected mood, and how seasons influenced physiology. From that observation, they built an entire medical system. Tonight, we're asking a serious question. What happens when that ancient system meets the modern exam room? Not as nostalgia, not as mysticism, but as clinical strategy. Ancient herbs, structured formulas, acupuncture mapped to nervous system regulation. Can traditional Chinese medicine, refined over centuries, meaningfully support the complex chronic illnesses we're seeing today? I'm Dr. Ryan Cole. I'm a senior fellow with the Independent Medical Alliance, board-certified pathologist. And joining me tonight are two physicians who don't just study this medicine, they practice it. Dr. Adylle Varon is a senior fellow in acupuncture and Oriental medicine, and she works daily with herbal formulations and acupuncture in integrative clinical care. Dr. Kristina Carman, also a senior fellow with the IMA, works in Nutritional and Holistic Health, and she integrates functional medicine, nutrition, and whole systems approaches to chronic disease. So tonight we're going to break down what traditional Chinese medicine really is, how it diagnoses differently, what the medicine actually consists of, and how it's being applied right now, not only to hormones, thyroid dysfunction, stress, physiology, gut health, et cetera, et cetera. If you're either a clinician or a patient navigating complex illnesses, this conversation matters. So it's a broad topic, and we're not going to summarize thousands of years of wisdom into just an hour, but we're gonna hit the high points and try to get into it here. So let's basically dissolve some of the confusion about TCM, traditional Chinese medicine. Some think that it's just all mystical. Others think that it's outdated. So Dr. Varon, let's start with you. In your practice and in your study, what is traditional Chinese medicine and what isn't it?
Well, I can tell you it's not woo-woo. That's the first thing I can tell you. Well, it's a system of medicine that was discovered over 20,000 years ago. It is an amalgamation of different systems that translates the body and representations of pathogenic influences. There are different theories that fall within it, but it is a theory of medicine, of short. It's basically a different way of looking at the body. It, like you were saying, that back then there weren't any surgery rooms, any ORs to dissect and interpret what was going on. So it was a system of medicine based on palpation, observation, primarily. Primarily, it now has evolved to many different theories, but in essence, it is where is the circulation, where is the chi, the movement in the body, where is it going, what is excessive, what is deficient, and we'll dive into that further in this conversation. But it's viewing the body with a different lens, a little bit more of a holistic approach and more natural. And yeah, we're going to go straight into it and talk about the different tools that are used within this theory of medicine and describe it a little bit more.
And I like that you bring that up, chi, energy, flow. So much of modern allopathic medicine is biomechanical and protein interaction, this, that, and the other. But the fact that our body truly is billions upon billions of energetic interactions on a micro level every moment of the day, and how those interactions flow together is so critically important. Dr. Carman, from your point of view, you practice a very holistic approach, and some of the areas in which you practice crossover with Dr. Varon's practice. What's your take on traditional Chinese medicine, what it is, what it isn't, and what some of the practices are that you see?
Well, I think very much echoing what Dr. Varon was saying about how it's very much looking at the person as a whole. And truthfully, I think that's one of my biggest frustrations with practicing even the way that I do and still working alongside many conventionally trained medical doctors or even in the allopathic kind of setting. And I do, and I'm very, very grateful for being able to do that. But the frustrating piece is that often the body is looked at in singular parts. So you have a gastroenterologist, you have an endocrinologist, you have all sorts of different types of specialties. And there is a place for that. I do understand that. But we've also forgotten that the body is actually fundamentally a whole being, and everything that we are is interconnected. And part of that interconnection, and where I think the Eastern medicine modalities really shine, is our connection to nature and connection to the earth and the energy that flows within us. And I think in many cases we've forgotten this, or we overlook that, or it's kind of labeled as woo woo in conventional medical standpoints because we don't understand that the terrain, the body's terrain, is so fundamental on how we develop disease and the things that we're predisposed to. Um, and so many other things besides just what's happening physically influences that. So our thoughts and our actions, the words we speak, all of these things are so interconnected. And my life's work will always be to try to bridge a bit of that gap between this very singular kind of separated look at a human bodies and human physiology, because there's so much more to us. And as we become more complex with our illnesses and diseases and challenges that are coming at us, I think it's really, really fundamentally important to dive deeper and really understand the human, the person that's in front of you, and all of its layers.
Wonderful. And I mean that I love that you bring up that it's all about balance and about all those systems actually belonging to one big whole. And I think much of medicine does forget that. I mean, so how does it differ basically from modern medicine, lab-driven models? How does traditional Chinese medicine use pattern differentiation? And why does this matter in chronic disease? Because you mentioned, Dr. Carman, that you do work with traditional physicians and allopathic, or not traditional, but modern physicians in allopathic medicine, but at the same time have an overlap into this
Yeah.
more holistic approach. So from that point of view, how do you approach that?
So a big part here is the time that I get to spend with patients, and that typically is upward from an hour for the initial intake. And a lot of that will be around uh, building a really, really comprehensive case history. So understanding their birth story, their early childhood patterns, their eating energetics, the relationships that were happening within the household and the family, any traumas, any childhood illnesses, any like all of those things are part of the story that I will collect information. So the intake is actually quite intense. And that is a very, very important practice in naturopathic medicine. And maybe Dr. Varon, you'll agree with me on this one, is the intake
Absolutely.
is the hugest part, the biggest part of really what we do and how we practice. And from there, we really understand the life force within this being. So do they have the energetic capabilities to receive supplements and herbs and all those things? Or is that terrain a little deficient at the moment? And from how are we going to actually rehabilitate that and support that in a way that um, reminds the body how it knows, how it innately knows how to heal?
But also how it remembers,
And
right?
how it
Yeah, and
remembers.
that's
Exactly.
yeah. Go ahead and go into that a little bit, Dr. Verone. Adylle, I like that you bring that up because that history and intake. I was with a very prominent national physician yesterday, and part of his basically personal health recovery was through traditional Chinese medicine and not allopathic medicine, though he is an MD, PhD. He went back to some of that family trauma, childhood trauma, and even the scientific studies that show generational trauma can affect gene expression and how your health is affected by other generational traumas. So how do you approach that when you have an intake for a patient,
Yeah,
Dr. Roan?
absolutely. Thank you for the question. I think what we also have to remember is not everybody's going to be honest on inquiry. And while it is one of our main forms of diagnostic tools, it's not always reliable. So I go to the pulse, I go to the tongue, and I go to the body, and the body holds memory. As we know, cellular memory is very real. So talking about Like Dr. Carmen, like how you were saying, you want to know the birth story. Well, I want to know how your mother was. I want to know how your grandmother was. So within these conversations, you start learning about someone's childhood. You ask deeper questions. Tell me a little bit about your parents. How were you raised? Because then that gives you a little insight on the development of the grandparents as well. There is in Chinese medicine something called prenatal essence. So you are already predisposed, predetermined on how you're going to be later in life. And once you get pretty well versed within pulse diagnostics, you start reading that. You're able to read the body without having to hear that story. The body will tell you. So also something to note within this is that people are also going to tell you what you want to hear, and especially it's a little bit uncomfortable when you're having the discussions with doctors like us, because we get a little invasive. We have the tough conversations when it does come to trauma, because our body wants to protect us from that. So even recall is it's challenging to even get through some of these conversations. So when you want to have those conversations, I do check in with the body. I feel what the body and how it's bouncing back when someone's giving me one of those more difficult conversations and stories. So yes, shifting diagnostic tools when it comes to that prenatal inquiry. I go to the body more
Mhm.
so because it can be, 9 times out of 10, very emotional for some people to talk about, because you don't know what the relationships with the parents were.
Well, and you bring up such a great point, and whether it's traditional Chinese medicine or modern allopathic or osteopathic, whatever you do, be honest with your doctor because he or she is there to help you. And that is a sacred relationship, especially for those of us here at IMA. That's how we approach medicine. And the more honest you can be with your history, the better your physician is going to be able to treat you. So I'm grateful you brought up that point. Now, it's a broad area and it's thousands of years old, obviously. And these two gals are much more organized than I, and they've brought some wonderful slides to kind of give an overview. So we're going to jump to those slides real quick, just so you can get a broader view of so many of the areas that are applied to this practice. So I think we have your slides first, right, Kristina?
I think so, yeah.
All right, we'll let you just jump right in and give us a great overview here.
Okay, so I think we've touched on this a little bit already, on basically what is the essence of traditional Chinese medicine. And I will make the point that there is a lot of crossover here with, let's say, Ayurvedic medicine or even Unani medicine when it comes to the balance and harmony when we're looking at the vital energy. So in Chinese medicine, it's the chi, the life force, but in Ayurvedic medicine, it's the Agni, it's that fire, the essence that runs through us all. But what I think one of the most beautiful parts of Chinese medicine is the five elements, and this interconnection of the human body with the wood, the fire, the earth, the metal, and the water. And it's this beautiful synergy of how we can connect with nature, but also really understand, where our energies are lying and where the deficiencies are. And it's actually a really incredible way, even from a self-reflection, from a patient perspective, to understand where their inherent weaknesses are and where their strengths are, and how to really kind of support that. Obviously, in a very clever and thoughtful way, hopefully with a clinician as well, but also then to have that self-awareness and that self-understanding, because we are all different. We all have different responses to different things, and to be able to really see it from that kind of lens is pretty beautiful. So that's my overview. I think Dr. Varon would probably chime in and add to that, I'm sure. But this is one of my favorite pieces in traditional Chinese medicine. It's the connection with nature and the earth.
Beautiful. All righty. And your diagnostic approach here.
Okay, so again, maybe this might differ between Dr. Verona and I, but when we're looking at diagnostic approaches, the biggest piece, and again, this is what we talked about, is observation. There'll be listening and smelling, inquiry, and palpitation. I don't do this so much. This is obviously done with a trained and licensed Chinese medicine doctor. I work mostly virtually now. and I don't do so much sort of clinical sort of hands-on work as I used to many years ago. But a lot of the observation and the listening pieces are still very much there. What would differ now, certainly with how I would practice, is I would probably do some diagnostics as well. And there is still a place for that, even within a very holistic way, to understand maybe what might be driving some of the things that are going on initially. But again, that might be very different to the way Dr. Varone practices at the moment. But typically, that would be the diagnostic approach.
All right.
Okay.
Next here.
Okay, so some of the key herbs that I may use in practice, and I'm just going to put a little disclaimer and a little sort of a notice out there is that I would highly recommend that you don't just stab at this from anywhere. I know where we do these incredible webinars and we have a lot of content, but it still makes sense to understand where you are individually. And it's not a one shoe fits all kind of approach. Herbs and supplements can be as dangerous or as potent as medications. And if you are taking other things and you are on, polypharmacy, shall we say, because that tends to be very prevalent in what we see now, you do have to be very cautious. So I would really just this is more for information purposes and just to understand how and what I would use in practice and why I would use it. So one of my favorite herbs is ginseng. I'll use pack ginseng, and this is really clinically, I would use this more for fatigue, immune support, stress resilience. I might use this in fertility, male fertility specifically can be really helpful. Astragalus, one of my favorites, so immune modulation, prevention, recovery, energy enhancement, also incredible kidney, tonifying the kidneys and supporting the kidneys. Reishi, look at amazing, sleep support, stress, longevity. Turmeric or curcumin, which we all know very, very well, I'm sure, for joint health, inflammation, circulation. We might use it digestively and even as a liver support in some cases. And then ginger. So again, it's very warming and very digestive. So looking at nausea and circulation, again, immune support. Also really good for motility. So for gut motility, I use ginger actually a lot in children, which can be really helpful sometimes. So those are some of them. I think I've got one more slide here on some of the herbs because I kind of went a little deeper just to give you guys some idea of some of the other ones that I might use. So Dong Quai is another one that I'll use, particularly in sort of the menstrual health, menopause, PMS kind of space. Rhodiola will be used as well for adrenal support, fatigue, mood. I mean, a really powerful adaptogenic herb. Ashwagandha, again, we know very well, talked a lot about, and lots of research around ashwagandha, even in more conventional settings, but thyroid function, stress, energy. The interesting thing with ashwagandha, and I'll just say this as an interest, like a note really from my training and when I was studying very much in Ayurvedic medicine, we would never really give ashwagandha to women, or certainly not pre-menopausal women. It was always something that was typically used in men because energetically, all of these herbs have either a cooling or a heating energy. And ashwagandha actually is meant to be very drying. So we wouldn't use that necessarily in a cycling woman. We would maybe use it more postmenopausally once they're no longer having the periods because a period is cool and wet from an energetic perspective. So not always a herb that we would use in that kind of case. We would use it more either in men or postmenopausally. So just again, little anecdotal side note on how, the approach even from an energetic perspective in Eastern medicine looks at a lot of these herbs very differently. Shishandra, one of my favorites for detoxification, hormone, stamina. Licorice, we were talking about that earlier. Again, comes with some contraindications, guys. So we have to be careful there. HPA access support, cortisol balance, digestion. So a really great one for this is again caveat here, so we'll use it in cases of H. pylori, with stomach ulcers, with GERD picture potentially. Okay, but again, clinically, we have to be very careful with how you're using it. If you're taking other medications, acid reducing medications, the form of licorice, all of that really matters. Okay. Shatavari, one of my favorites as well. Female reproductive health, really good for stress as well. And yeah, as you can see, there's lots here, guys, that we would use. So there's some crossovers, obviously, with using different herbs. I would also say that I typically don't use more than 3 herbs at a time in practice because, again, I want to understand how the body responds and how what's working and what isn't. And I think this is a really important thing for all of us to remember, particularly when we're looking at choosing supplements as well, because there's so much out there and constantly, even on social media, we're given a new ad for this longevity supplement and this, that, and the other. And we're like, oh, get really excited. And like, it's like being in a candy store, like, I'll try this and try this. And then you end up with like 38 different things. And you don't actually know what's working for you. You've spent an extortionate amount of money, but actually what's the upside? So we really have to understand when we're looking at herbs, when we're looking at supplements, what are we trying to achieve? And you're not just throwing something at because, oh, I'm tired. Well, why are we tired? Let's dig a little bit deeper into that, understand where the fatigue is coming from. And then maybe it's appropriate to look at the rhodiola, or maybe it's appropriate to look at something else. But I think it's should be, and it has to be individualized to the person where they are, and where they've come from, what they're bringing to the table as well.
And that's such an important point that you bring up is many people think just because something's good, more of it will be better.
Mm-mm.
And you bring up that critically important point. And I think we'll do a show on this in the future to consider drug herb
Yeah.
interactions, herb drug supplement interactions. Even the timing of taking certain herbs and or supplements is important during the day. Chrono supplementation or using herbs at different, whether it's morning or evening. And so just because something is good doesn't mean more is better. Goldilocks effect on everything in life, of course. And it,
100%.
it is so individualized. And that's such an important point you bring up. Dr. Varon, I know you have some slides and some important seasonal things in terms of some of these herbs and the importance in the practice of energy this time of year. So let's go over to your slides and get some more insight from you.
Perfect. Well, we've already kind of discussed what traditional Chinese medicine is, where we want to see the system being balanced, which means healthy. And just to talk about a little bit about when we see dysregulation, most of the time it's either due, we spoke about this a few weeks back on the webinar, due to stress, overwork, diet, and environment. I'm always going to stress that and always going to inquire about what is going on. So Livia, let's stay on this slide for a little bit. No, the next one, please. Thank you. So the basis of this is that there always has to be a balance between what is yin and what is yang. And yin, think of nourishment. Yang, think as movement. So there's always going to be, when we see the yin yang symbol, we see a dark side and a light side. If you were to split this diagram into slices, if you were to slice this, there would always be an equal balance of what is dark and what is light. So there will never be an absolute, there will always be a little bit of yin within a lot of yang, or a little bit of yang within a lot of yin. And that is a system of medicine within Chinese medicine of its own. But for today's purposes, we are going to only talk about what is 4 levels. So just think of qi as your circulation of what moves the blood in the body. The blood nourishes the body, and the fluids in the body moisten the tissue in the body. So we think of movement. When we have movement, the body is able to restore itself. When there's too much of one thing, there will be an imbalance. That is plain and simple. So for instance, with cold, whenever we see the environment becoming cold, we see our joints ache. We see that arthritis kick in a little bit more, because when there is contracture, there is pain. Can I have the next slide, please? So again, just to echo a little bit of how Kristina works in her clinic, I work very similar, but I am very hands-on. You can ask all of my patients. I'm always checking in with the pulse during treatment, because the pulse will change. The pulse tells a story. And when I say pulse, I mean the radial pulse on the wrist. We distinguish and identify different levels of the body and different depths of the body and determine whether or not we have an excess condition or a deficient condition. Is the deficient inside? Is it outside? Where is it lurking? The pulse of your body will tell you so much of what's going on. Also with your tongue maps out what is going on inside of your body. The way you are talking to someone is telling us what is going on internal organ wise as well. What is going on with your muscles, what is going on a systemic level can be differentiated just by the tone of your voice. Smelling, not so much in my practice. Office tends to smell a lot like Moxibustion, which is a technique we'll talk about later, so it's a little hard to determine sometimes. But palpating the channels of the body, which is something we haven't kind of gone into. The body is divided by many channels. This is where the chi flows within the body. That's why when we ask about traumas, whether emotional or physical, we see that stagnation within those channels. And when you palpate said channel, so when you press on these channels on your body and you find a tender spot, that's really telling us where some of these blockages are going. And so for the cases of this conversation, we're going to be talking about the 4 levels. So your defensive layer, talking about the outside layer on top of your skin, the chi that protects you, your wei chi, your defensive chi that protects you, that opens and closes the pores of the body, that allow for that regulation of pathogenic influences. So the chi being the circulation, your blood, your actual movement of your blood in your body, that allows for everything to move. So when we say jing, we mean nourishment, the body fluids. And when we say shui, we mean the blood of the body going into the muscles and the organs. Can I have the next slide, please? Thank you. So let's talk about the tool. So the first tool that everybody knows of is acupuncture. Sometimes this medicine is referred to by its most popular modality, which is acupuncture. Acupuncture is a tool that we use. We use filiform needles that are inserted into certain acupuncture points on the body. Think about if you were to poke yourself with a stick, or you cut yourself. What is the body's first response going to do? It's going to start healing. So we're doing this on a microscopic level with the entire body. Next slide, please, which I'm really excited about. So another tool that we use is called Moxibustion. It is a dried herb coming from Artemisia, so mugwort. This is a warming technique used for deficient type patterns, but also can be used for excessive. So very good for shingles, but I'm going to show you all because I like show and tell here. But Artemisia moxa is a loose herb sometimes, and it looks like this. And with this can also turn into something that looks like a giant cigarette. So this is another tool that we use in place of needles when we want to really promote a lot of movement, when we have someone deficient, when we have a lot of cold in the body. But typically what you'll see is people using these sticks on certain acupuncture points to warm up and to activate the channels. And sometimes you'll see people roll up these little balls of moxa, put it on a needle and light it. We call this warm needle technique. Now, what is very popular right now, and a lot of videos are coming out, is something called ginger moxa. So you grab slices of ginger, you put it on, let's say, the spine. I use this a lot for autoimmune disorders, but layering the spine with some ginger, rolling up moxa on the ginger and lighting it. And it is an incredible immune boosting technique in order for the body to regulate on its own. There are also many forms. Everybody knows I love the Griffo brand. They have a moxa stick. They have a moxa spray. There's moxa in many forms, but this is a very good thermoregulating technique to use in cases such as chronic fatigue syndrome. Moxibustion, the stick itself can be used around a shingles outbreak. You can do it on your eyes. There are just many forms for it. Anything that needs a nourishing component to it, or heat clearing. So it's one of those things where you have to find balance between the two and find the right situation for it. Other tools that we use within this medicine are cupping. where we place the glass cups on over muscle tissue and allow for the fascial release. We have something called Tuina, which is Asian body work. It is manual therapy, very similar to like lymphatic drainage, just a little bit more invasive. We have, sorry about that. Something that we can't use, at least in the state of Texas, is something called bone setting, very similar to chiropractic work. In the state of Texas, we cannot practice this, but very similar, translates to what it is, setting the bones. We have a plum flower technique, which is a 7-needle hammer that hammers into the skin in order to, again, promote circulation, activate the chi, clear blood. We have bloodletting. There's blading. There's a whole toolbox that we have, but that is just to cover the surface. And I bet that's a lot of information. But the reason I really wanted to emphasize the moxa is because we're in prime moxa season. Whenever we have a season transition, especially from winter into the spring, we like to use this warming technique because it is said to enhance the immune function and also to protect us for the winter time. So we use this as a modulator to improve our immune system post-summer heat. Also very popular during the heat of summer to protect you during the dead of winter as well. And
So
yeah.
in terms of like all of these, so the different herbs, they're not, I mean, some come from seeds, some come from bark, flowers, etc. Sourcing, I think this is where going to an experienced practitioner is important. And what's your opinion on in terms of where one sources different things? Because there's so many different things online in this day and age.
So I would definitely recommend going to someone who is licensed, someone
Mhm.
who is, well, now it's not NCCOM, they have changed it to NACHAM, I believe. But someone who is naturally certified within this in Oriental medicine, not just in acupuncture, that has both the acupuncture and the herbal medicine, someone who is very well versed. That being said, even if they're just certified in herbal medicine and not acupuncture, is even better for herbal medicine solely. Also, you mentioned, I think it's really interesting that you have mentioned plant pieces, where Chinese pharmacopoeia is not just plants.
Right.
We have insects, we have shells, we have minerals. So I do believe that finding good manufacturing processes and finding those distributors is very important, because a lot of these herbs can contain sulfites, and we have to be very careful with whatever heavy minerals are on these as well. I believe there was a Grey's Anatomy show once about a woman who ingested Chinese herbs from like a grocery store, and it was heavy metal toxicity.
Yeah.
So like, but it's very true. You have to make sure where your herbs are coming from. I really like the Evergreen products out in Washington. I believe that's where they are. They have a really good herbal line. But going to a trusted, reputable source and making sure that your herbalist and your TCM practitioner is sourcing the good quality herbs too. I think that's very important to know.
Well, I mean, even looking at our modern food supply and the studies that were recently done in Florida showing arsenic in children's candy and baby formulas with mercury and bread with tons of glyphosate. It's so important in this day and age that there are so many things that are marketed and sold that one goes to a very trusted source. You're absolutely right. And for those who kind of think that, oh gosh, this is just all woo and I'm going to take this herb or that herb, the majority of modern medicines are derived from natural products. And then just a molecule group is modified on certain modern medicines and they get a patent and then it becomes a pharmaceutical medicine. But so much of what humanity has depended upon for eons has been natural medicine. And these natural herbs and plant products or animal derived products or just different parts of nature putting things back into balance. And so I think that's an important aspect of this. I know a lot of people keep asking, what about some of these approaches for chronic illness or long COVID? What are both of you seeing in terms of some of the medicines that seem to have some effect in those areas?
I mean, certainly from my perspective, absolutely 100%. But it comes back to really understanding the individual and understanding their terrain, because everyone's response to long COVID would have been different, right?
Absolutely.
And whether there were other things underlying, whether there were some pathogenic overgrowth, or an Epstein-Barr, or, um, there's so many different things that we've carried with us or are carrying with us. Maybe there are some histamine issues or some mast cell issues, and we weren't really aware of any of those things until suddenly there was an extreme viral load put on the body or a stress. And then it happens. And this is again where the difference between allopathic medicine and more Eastern modalities come into play is that we are not just treating the symptom. So it's not just pathogen and solution. It is looking at the person as a whole, their history, and where they are now, obviously, through the physical examinations that are necessary to really understand what the body is telling us. What is the human being in front of you telling you as well? And there's so much that we can learn from that, how they're holding their bodies, where they're holding the stress, the facial expressions, um, it's a tremendous amount if we're actually really physically seeing the person in front of us. And unfortunately, doctors are rushed, and we don't even look up from the chart in many cases, so that we're really seeing that there's a human being in front of us, and it has to be individual. So I mean, I guess coming back to my approach is that I will approach this looking at it as the whole person. What's your diet? What is the sleep? What is the movement? What is the sort of the terrain and the capability? Where's the strengths? Where's the weaknesses? Where, you know, nothing just develops overnight. It comes from something. There's always a reason for it, right? And when we're looking at chronic illness, it's not just from one day to the next. This is a long time of brewing, of deficiencies, of stress on the body, of inflammation on the body, of okay, yes, we have some inherited things that we carry with us, but that's not me. It doesn't mean it's set in stone, right? There has to be some switches, and we have to see where that's coming from and how then we can really support the body to heal. I will say once chronic illnesses are really established, it becomes much more difficult and more complex because you're essentially peeling back the layers, and people find it really difficult, particularly when we're doing it more naturally because you're not getting the results straight away. And in some cases, you may feel poorly before you feel better. It's something called a healing crisis, where you're going through the layers of like healing hierarchy, of the hierarchy of needs and disease, right? These are very, very like true naturopathic techniques, but this is how our bodies heal. It has to unravel what it built up over time. So it does take patience. It does take compliance and accountability and all of those things, which we really struggle with, massively struggle with.
So you're
But also,
yeah, go
sorry,
ahead.
but
Go
also
ahead.
as practitioners, we have to humble ourselves and say, okay, I'm not doing like if we're not getting the response that we hope for, we can't just say, okay, well, our patient's doing all the right things.
Yeah,
I did all the things. I have to reevaluate and say, okay, well, maybe I did something wrong. And I
100%.
think that is the biggest part, especially for the conventional world. And some doctors that we all may know. It's really hard to say, oh, maybe I was wrong. Maybe I should take a different approach and maybe treat that one symptom so I can get to the root. Because I know
Absolutely.
everybody's always like, oh, we got to treat the root. We got to treat the root. Well, we can't get to it if some of these symptoms don't go
Yeah.
away.
Yeah,
So
absolutely. Absolutely agree.
it's very important to acknowledge like, yes, this patient's coming to you and they're telling you all of these, and yes, we want to get to the root, but also we can't dismiss the pain, the stress, or any of that. You have to find that balance.
So what you're saying is everybody is their own unique tangled ball of yarn, and you have to untangle that ball of yarn uniquely for the individual that's in front of you.
100%.
Yeah.
And part of that might be asking for help and saying, look, this is beyond my scope of practice. I need some support here. And it can be and maybe should be an integrative approach. And that's where it becomes like, oh, can we blend some of these incredible ways to support humans? Because I had a really lovely friend of mine say to me the other day, she's a clinician as well, and she was like, we don't have vanilla patients anymore. We have really complex, really ill people that are coming constantly that have lots of different things going on, and we don't know what, like, you're like, oh my goodness, where is this coming from? So that might take more of an integrative approach. Would I be silly to say that only acupuncture is going to work in that case, or herbal medicine and tinctures? Maybe not. Maybe they'll need some diagnostics. Maybe they need an MRI scan, or you know what I mean? Like, we have to be able to use all of these incredible tools that we have at us and be open to them and be humble about saying, like, I don't know it all. It's okay. I need help.
Well, and to that point, for both of you, do you use, obviously you use the traditional approaches, which is fantastic, but measuring some of those outcomes from a diagnostic laboratory point of view,
Yeah, I do.
you utilize both realms, both of
I,
you?
I do, but I do weird labs, like labs that wouldn't be conventionally used. Like, I use a lot of organic acid testing. I use hair
Mhm.
tissue mineral analysis. I'll use tox panels to see heavy metals and toxic and mold exposure, mycotoxin testing. I do a lot of that.
True.
And then GI map testing. So these are not necessarily conventionally run.
Right.
Usually I will say to a patient, get your conventional labs done through your PCP if that's something that is within your remit. We can evaluate those, but if really it's not giving us the answers, we can dig a little deeper and see if there's actually some, toxic exposure that actually is really affecting. And I see this a lot, even with children, that they've inherited all this like exposure, and we have to support the body in order to kind of heal. And a lot of that is like boosting the immune system, supporting that immune resilience. And, I'm simplifying it massively here, but yeah, I do use some diagnostics now.
How about you, Dr. Brown?
I use my hands.
There you go. That's a
I use my hands and I use my ears. But
probably.
I am, so mind you, I work with Big Varone, right? So we, sorry,
I like that you call him that.
I
That's
love that you call him that. That's
sorry.
the best.
Sorry, Dad. So we bounce off each other. So whenever he's like, I'm gonna do all the things, I'm like, okay, well, let me do my thing. But then I'll start talking to a patient. I'll be like, did he check this? And they're like, no. And then I'll go up to him. I'm like, why didn't you check
Hmm.
A, B, and C? Well, it's not necessary. I was like, why not? So we'll have those discussions. I don't need them for my treatment, but it's good to have and get other things. And sometimes we find other markers and he'll be like, okay. Like he'll just give me that. He'll be like, okay. Or sometimes he'll be like, I thought of that.
I love that.
And so we have those conversations in this office. Do I tell people, hey, have you checked your hormones? And they'll be like, no. Okay, I'm here to literally poke you in more
Mhm.
than one way and remind you of these things. So do they affect my treatment? Not necessarily.
Yeah.
Do I
Well, and
shit?
you bring
Right.
up a great point. The beauty and the art and the practice of medicine started with actually physically touching the patient and looking. I love that Dr. Carmen brought that up too. Looking at the patient in front of you. And any more you go to a doctor and their faces in their computer screen, making sure they check all the
I
boxes
look
for the
at that.
billing code,
Yeah.
this, that, and the
Yeah.
other, instead of realizing, wait a minute, this is a human to human healing interaction, and that you lay on hands and heal as an art is a lost art, unfortunately, especially on some of the more techno younger generation going into medicine. So the fact that you both bring that up, I think, is so critically important to how we truly connect with humanity and with the patient in front of us. And that's such an important point that you both do. And I super appreciate that. Also, what you're both bringing up is this team approach. Because sometimes, as you refer to Joe, Big Verone, sometimes each of us, if we're honest, we don't have the whole answer. And to bounce difficult challenges clinically off each other is such an important aspect of learning and healing on behalf of the patient as well.
And I think it's important to remember that if you have a doctor or a clinician that isn't really willing to look outside of the box, or if they got to a point where they can no longer help you, to not just give you a flippant answer to be like, go take this and pray,
Right.
but to say, like, let's see if we can find, let's see what we can do. Is it a referral? Is it
Right.
bringing in different minds? Is it, and if they're not willing to do that, then I would say try to find someone who is, because
Yes.
if you have a complex situation, it requires a complex approach. Um, and obviously you can put your eggs in lots of different baskets, and it does get very confusing if you have a herbalist and you have this and that and the other. But to a certain extent, there needs to be a little bit of crossover, I think, to get, the outcomes that you really need.
And how does one find a trusted provider, Dr. Varone, in terms of, traditional medicine, traditional Chinese medicine or Oriental medicine?
So and it was formerly NCCAOM has a database.
Okay.
Put your zip code in, and it will show you within your radius who's near you. It will say AC, OM, or H, I believe. You want to find the OM, especially if you're trying to find the full package. You want to find the OM next to their name, meaning that they are certified, board certified in both acupuncture and herbal medicine. And they have hopefully their information up on there. Typically, when some people on these webinars email me and they say, "Hey, I'm looking for someone like you near me," I'll just go there, unless I know someone personally that's in their zip code. But the website, I go through their web pages and I see
Mm.
which one reads the best to like send off. Because I know if they're credited with that organization that they are keeping up with their hours, because we have to do a ton of additional hours just
Yeah,
for
me
the
too.
board.
Yeah.
And they're very on top of it. The
Great.
NCCOM is very on top of it.
And I
That
know
depends state to state too.
another question comes up, and I think this is important in terms of going to a trusted provider if you're going to go the traditional Chinese medicine route is, people want clean needles if they're going to do acupuncture and sterility and things of that nature in this day and age, and just making sure that they're going to somebody who's doing things properly. So that's kind of why I brought up that question. The other question I do have, which comes up from time to time from those who are dabbling in the realm and don't trust allopathic medicine, aren't sure about new modalities, is how much science and evidence is there behind it? Obviously, you're not going to go to the four major medical corrupted journals and find this type of information, but I mean, this is thousands of years of medicine. Where does one find studies that validate some of these techniques that both of you use?
So there is a journal of acupuncture. There
Okay.
is the Journal of Acupuncture. Um, oh my gosh, I should know this, Ryan. I should
Don't
know.
worry about it. Don't worry about it.
But there are journals within our world. There's the Journal of Traditional Chinese Medicine. There's the Journal of Acupuncture and Herbal Medicine, probably is what it's called. There are many journals within our world. And also, as we were talking about earlier, there are books that are evidence-based. Ryan and I were talking about electroacupuncture earlier. So
Mhm.
there are books. There are many, many books with many resources and references out there. That exactly how this medicine was made from the Huangdi Neijing. So the Yellow Emperor's uh, classics. So even from day one, this medicine has always been from text. It wasn't something that was verbally handed down, but it was something that was already written. And we get to write the next chapter. Isn't that beautiful? Like we get to write this next chapter of integrative medicine, sharing our knowledge with everybody out there watching us. And
Well, I
hope.
think I think that's what's so cool is, there are people that love it, people that doubt it, but at the same time, what works for the patient? And I think the further we each go in our journey, we're surprised at things that do work for unique patients in unique situations. And yeah, we are writing the new chapters of modern medicine because the system has lost trust. And as we find things that work and show our work and publish it and show how patients are benefiting, I think, the fact that one group doesn't have a monopoly on knowledge and healing is a pretty cool thing to learn in life.
Mm. I'm gonna add a little something to that. And I
Please.
know that we're very much science led, and I do understand there's a place for that and really important to understand and follow the research. But we we have gone down such a rabbit hole with like, where's the research? Where's the research? And we forgot actually that these are medical approaches that have been around for thousands and thousands of years. There's a reason for that, that they haven't been brushed away, they haven't died off. There's efficacy there. And to a certain extent, can we not just trust that?
Right. Well,
Without
and
needing all the
to your
like I need the research. Where's the research? Where's the
right,
research? And I'm like, I get that, but
right.
also, you know, there's a
Well,
balance.
the fact that everybody, their body is actually connected to their mind, it's
Yeah,
actually connected to their spirit,
yeah,
body, mind,
yeah,
and
all
spirit,
of it,
all three
right?
things in balance, going back to Dr.
Yeah.
Baron's point of
I think
chi.
it's yeah, exactly. Like then we're like, well, where's the studies for that we have like blood and energy? And I'm like, hang on a minute, have we forgotten that we are energetic beings, that we live and function and we are connected to the earth and nature and we need the circadian rhythm, we need the light, we need all of those things in order to really survive. We need the light and the darkness, right?
Hmm.
But no, where's the studies?
Yeah, without the contrast, there's nothing. So that's a great point. Um, in terms of, we've done shows on nutrition, but is nutrition an aspect of traditional Chinese medicine for both of you as well?
Oh yeah.
There's a whole, like,
Oh yeah.
traditional Chinese dietary therapy, it's its own realm. Like that is
Hmm.
its own system of medicine too. It takes the concepts of Chinese medicine and adds that as energetics into food. When you come into my office and you have your initial consultation with me, 10 out of 10 times, maybe 9 out of 10, I send you home with a little info graphic of traditional Chinese dietary therapy. That is the most translatable piece of like document that I have that people can read and connect with. So then when they start talking about damp, which will be for another webinar, we'll talk about damp, we'll talk about heat, we'll talk about phlegm, hopefully.
Mm.
Um, Buckle up for that one. It tells you which foods are good for eliminating damp, which foods are good for eliminating phlegm. And so they start realizing, oh, I eat this and this is how it makes me feel. This is fantastic. So they start understanding what damp and phlegm is. And then they start thinking clearer and they
Mm.
realize, well, the food is let food be thy medicine, right?
Hmm.
So that is that I always go food first, then herbs. I
Okay.
always change someone's diet. Well, uh, they volunteered to change their diet. And then I add in herbs. If we do all of those and herbal medicine, boom, like a couple weeks in, they notice a huge change. But if
Yeah.
they're really hesitant on herbs, we do strict food as medicine.
Fantastic.
Yeah.
Yeah.
Always. The food is the first.
Yep.
It is a big, big, big needle mover for a lot of people.
There are many books on it too. You can
Mm.
find many, many books about Chinese dietary therapy.
I'm
Uh,
going to try to see if I can find it here in my office. I have a really good, it's actually very user friendly and it's a small book, but I'm going to try to
Yeah,
see if I can
and
I have
that's such an
so many
important
books,
point.
guys, on the shelves everywhere. They're like bursting at the seams. I'm such a bookie nerd. But I'll pull it out and see if I can share it in a moment. I'll see if I can find it.
And
It's a
that's such an
good one.
important point in terms of the type of food for the condition you're experiencing and where you source your food. We'll go back to that whole thing of sourcing with our corrupt food systems
Mm.
and our adulterated food systems, sourcing natural, as close to nature as possible, and foods in the season where you
Oh
live
yeah.
is so important as well. And we are so out of the cycles of life, and we are
Totally.
so out of the cycles of who we are as human beings, and we forget just some of the basics because of our modern workaday world and the pace at which we zoom forward through life, forgetting this connectedness that and you both are so grounded in what you do and bring such a broad knowledge base to it. And I think the point for some of the listeners, and correct me if I'm wrong, please, is you don't have to do everything all at once. And I love that you brought that up earlier, Dr. Carmen. Is look, we're only going to start with a few things. Now, we're not going to put you on 20 herbs. We're not going to polypharmacy you with traditional Chinese medicine. We're going to find the approach that works for you as an individual. And yeah, both of you, please just comment on that construct or that approach.
Let
Yeah.
me jump in right there real quick because some people do prescribed formulas that have like 25 herbs in it. So the evergreen that we talked about, some of those formulas have like 25, 30 something herbs in it. Great brand, but they just, that's their way of doing it. Some people even prescribe formulas as single herbs. So they'll put 3 formulas in one formula. So it really depends. Kristina, I'm right there with you. I'm very much like, let's do a couple herbs, put them together, here you go, or just stick to like to one herb and see how that course goes. Not everybody is like that. So just big disclaimer when you start saying you're herbalist and they're like giving you formulas that have 25 herbs in it, everybody uses herbs differently. We just have a different approach for
Agreed.
ours.
And what people forget is, when you cook, you're using different herbs, and a lot of those herbs have
Exactly.
medicinal
Oh,
qualities.
yeah.
Exactly.
And oh gosh, we could talk for hours, and I
And I
know.
mean, that's a great place to start, right? Start introducing it in the diet and see how your body responds.
Absolutely.
Like people think, oh, I need to eat lettuce and then I feel so poorly in salads and things like that. I'm like, salads are not for everybody. And
Right,
look at
there
the
you
time of
go.
year. Should we be eating salads right now when it's winter and it's cold and actually we
Absolutely
need
not.
grounding and root vegetables?
Absolutely not.
Right.
No, and they're like stuffing salads and like turning, it's not right. Like we have to really understand why we're doing something and how it's really going to support you overall and what are those
Absolutely.
outcomes. So
Yeah,
Yeah.
TCM docs are probably the only doctors that are going to tell you not to eat salads.
I know, I'm like,
Well, we have.
there's a time and place for that too, right? Like look at energetically different times of the year. Maybe it's appropriate, but also look at the constitution. Not everybody will fare
Exactly.
well with raw, cold food.
Right where you are, when is the time to eat where you are. Well, we've had such a wonderfully engaged audience tonight, and I know there's
Hey.
tons of questions, and I see Autumn popping on here,
Yeah.
so I know we're going to have time for a few questions. I wish we could answer them all, but uh, just everybody that's been asking about the slides, tomorrow afternoon, those will be available on the website. And if you enjoyed this, please, share it with others. But Autumn, go ahead. I know the audience had some great questions coming through there.
Yes, thank you for those audience reminders, Dr. Cole, and I'll jump right in. One of the questions we got from Linda M was asking if you guys could talk a little bit about how individuals hold stress in different parts of their bodies.
And their livers.
Mm.
But your Chinese liver. So there's going to be a Chinese liver and there's going to be a biomed liver. And I know that sounds absolutely insane, but I'm talking about channel theory here. So I'm talking about those meridians. I'm talking about those neural pathways that are our regulators. So in Chinese medicine, the Chinese liver is the governor of your emotions. So whenever we're stressed out, that liver is going to tighten. So when we're stressed out, we're clenched. We feel the clenchedness in our jaw. We feel our shoulders come up. We feel everything just getting really angry. So yeah, broaden those shoulders. So really with this world, we're going to see all of that liver chi kind of live here, but then also affect our gut. So we're going to see digestive symptoms come along with it. We're going to see a thermal dysregulation there as well, where you're going to feel flushed. You're going to have some spontaneous sweating with that also. So those are just some typical manifestations of when we have what we call a liver chi stagnation with that stress. It will live here or it will live in your gut.
I'm going to take that even one step further, that we might even see that manifesting in changes in hormones and how you metabolize and break down hormones.
Mhm.
So the liver
Interesting.
as well, like women who have very heavy periods and very, very bad PMS symptoms, always look at the liver.
Yes.
We also got a lot of questions about the body's electrical energy field system, and Julie asked, there are vibration plates that are popular. I wanted to get your opinions on how this is related to Eastern medicine, and if it is. Thank you.
We're talking about those vibration plates that you stand on.
Mm-hmm.
I love them.
I
I
used
love mine too.
I used mine this morning. I can go
I'm
nerdy
jealous.
pathologist on you and talk
Yeah,
about what
yeah.
it does for electrical activation of your blast that builds bone.
Mm.
They studied it on astronauts in space, basically, and you have a lot of bone breakdown, osteoclasts versus blasts. And using the right frequency on a vibration plate, especially for osteoporotic women, will stimulate those cells to start to send an electrical signal to lay down bone again. So that's I think we're going to do an entire, we talked about this earlier, do an entire webinar on electricity as medicine and the body bioelectric, basically.
Yeah, I love it. I've got a vibration plate under my desk and I will stand on it several times a day just to like give myself a
Mhm.
good old jiggle. It's really, really helpful.
But it goes
And
to it's that movement as medicine, right?
Yeah.
We're using
Yeah.
movement as medicine. We are we live in such a stagnant society that runs off vibrations. And so we feel that inside. So standing on that vibration plate, you're breaking everything up. You're getting everything moving. Now it's not for everyone. I will say that. So if you're trying to get pregnant, you're a fertility patient, do not get on this. Do not. Please. So it is not for absolutely everyone. But for those of us that feel very stagnant, we have a lot of damp and phlegm. I'm really pushing this webinar for the damp phlegm.
Okay.
It would be fantastic as it works with the lymphatic system.
yeah, agree. We need to flow. We need to move stagnation around. We're so super sedentary, like way too much. And it's causing a lot of problems for a lot of
And for lymphatic flow,
yeah,
absolutely.
yeah,
You're absolutely right.
absolutely.
We also got a lot of questions on the Moxibustion. Laura asked, please tell us more about it. You light the herbs with fire on the skin. Do you burn the skin? Can you please tell us more?
Can that be a whole webinar? Like I would be
Yeah.
so happy. Can we do a
It could
Moxibustion?
definitely be.
Yeah.
Okay, so yes. There are different ways of doing it. There's millions of ways of doing it. So like it in essence, yes, you do burn it on the skin. No, it will not cause a blister. There are ways that we do it that if you go to make sure you go to a good person. There's so much to unpack. But normally within here, I will say no, we do not burn you with it intentionally. I mean, there is a rice grain version that we do burn you intentionally, but it's controlled. So it will not, I mean, there is scarring moxa as well. There's a whole thing. But yes, it is amazing. It is a warming technique. It is great for fertility. It is great for chronic fatigue syndrome. It is great for any sort of arthritis. It is fantastic for reproductive health, which I think I just mentioned. Anything cognitive, it helps the spinal fluid kind of move faster too. So we're working really well with like Alzheimer's, dementia, ALS. It is fantastic for neural communication.
Well, I'm looking forward to trying it when I'm down there in Houston visiting.
It is so great.
Me too.
It is a great world. And there are sprays, there are balms. It activates with heat when it is not lit. There are smokeless versions. My dad's gonna kill me for having this in his office right now. I swear it's Moxa. There's the stick version. Yeah.
Very cool.
We didn't even talk about ear seeding.
Well, there's so many questions that I wanted to go through, but since we are already 4 minutes over, I will pass it back to Dr. Cole and let you guys give any closing thoughts that you might have.
Yeah, ancient wisdom, it's not about nostalgia, it's about accumulated clinical observation, and this is centuries of it. And when we combine centuries of pattern recognition with our modern tools, we can expand how we care for complex illnesses. And just exceeding thanks to both Dr. Carman and Dr. Varon for helping us understand how traditional Chinese medicine's being thoughtfully applied in clinical practice today. And with that, any final comments from either of you, and then we'll turn it over to Autumn to close.
I think really for me is thank you so much for allowing me to be a part of this. It has been an absolute honor to be a part of this webinar, and let's do more because we need to talk more about all of these things in naturopathic medicine and Ayurvedic medicine because there's a place for it all for everyone and for anyone and anywhere you're coming from. I think we're all individuals and we now really have to find the best tools and the best support that's going to work for us. And that might be a multifaceted approach. And I think find those clinicians to work with that are open to explore those ideas, because we can use chiropractic, support for the body. We can use acupuncture. We can use all of these different things to really drive the change and to really support the body, so that you can live your best life and you can enjoy your life.
Dr. Varon?
Thanks for having me. I'm very excited that I'm able to join y'all's world over at IMA. Y'all have welcomed me with open arms, and I'm very much appreciative with the response and the embrace of this wonderful world that is Chinese medicine, and East Asian medicine in general. We everything that we do at this office, we're hoping to mirror out into the rest of the world. And I think that it starts with conversations like these, being able to humble yourself and ask questions, ask for help when it's needed, and being able to collaborate and share information. And I'm honored that I'm able to share what I was taught with you guys and continue to learn from y'all, and have these conversations. So
Well, thank you both very much. I think all of us were enriched by this tonight, and each of us learned something new. And the audience has brought up so many good questions and future webinars for us to go into. And don't worry, Dr. Varon, we will hit some of those other deeper topics in another webinar. So everybody, thank you for joining us tonight. And we look forward to you joining us on future IMA shows. And there's just so much for all of us to learn and open our minds to in the ways to heal and stay healthy. And with that, thank you, ladies. And I will turn it over to you, Autumn, for some closing remarks and announcements.
Sounds good. Thank you, Dr. Cole. Thank you, Dr. Carman and Dr. Varon, for joining.
thank you.
So just a few important updates and reminders. This year, April 17th through 18th, we are hosting our medical education conference, Emerging Trends in Medicine. This is a 2-day gathering dedicated to the latest innovations, research, forward-thinking practices, really that are shaping the future of healthcare. The entire conference agenda has been approved for continuing medical education credits. Attendees can earn 12.75 CME credits, and the schedule includes 2 ethics sessions, which fulfills a common state requirement. This event offers a dynamic program of expert-led lectures and valuable networking opportunities. You can get your tickets today while early bird pricing is still available at imahealth.org/conference. We have released a brand new guide on women's hair loss created by the lovely IMA Senior Fellow, Dr. Kristina Carman. Fewer than 45% of women maintain a full head of hair throughout life. Yet female hair loss remains one of the most dismissed and undertreated concerns in medicine. This free guide takes a whole body approach, reframing hair loss not as a cosmetic issue, but as a signal from the body. It explores root causes through functional and naturopathic lens and offers evidence-informed strategies to support regrowth from the inside out. You can download this free guide at the link on screen, which is geni.us/women's hair loss, or by scanning that QR code that you see there. And as always, your support makes this work possible. IMA is actively building a trusted referral network, connecting patients with independent clinicians who are vetted for ethical patient-first care. This platform is designed to answer the question that we hear every single day: where can I find a doctor that I trust? Your support helps fund platform development, provider onboarding, and public access so patients across the country can connect with physicians who share their values. You can support this work today by donating at imahealth.org/donate. In just a moment, we're going to formally close tonight's show, but we wanted to close with a short video about the Trusted Referral Network and why it matters so much. So let's take a look, and we'll see you next week.
Right now, patients are searching for doctors they can trust. and clinicians want to practice medicine the way it should be practiced.
The most common question I get asked by my patients now is, who can I go see? Who can I trust?
The Independent Medical Alliance is changing that. We're launching the Trusted Referral Network, a verified directory of independent, like-minded clinicians committed to ethical, patient-first care.
It needs to be a bilateral relationship where they each communicate with each other.
For patients, find a doctor who will listen, understand your health, and partner with you in your care. For clinicians, connect with a network that shares your values and commitment to individualized patient-first care.
So the Trusted Referral Network is going to help us by empowering physicians. But number two, is going to empower patients.
Help us build the Trusted Referral Network.